variant, which has been bubbling away as a fear, huge impact on specific areas like Bolton, Blackburn. Now, it seems to be that the numbers are going up. Thankfully, not straight away hospitalisations. And on front of many of the papers, that seems to be the thing that could ruin our summer and then put off that June 21st Freedom Day date.
Yeah, that is the big question. So we've seen a double in the number of infections of this Indian variant. It's gone from 3,500 to around 7,000 in the last week. 75% of people with new infections have this Indian variant. So it's fast becoming the dominant strain in certain parts of the country. What we've seen in terms of hospital admissions is a slight increase in hospital admissions, particularly among those people who haven't had a vaccine or have only had one of the 2 doses of the vaccine. But the next 2 weeks are crucial. That's what the experts are saying, because there's a lag between new infections and hospital admissions. And we need to know whether the vaccines break that chain between infections and admissions. Boris Johnson has said it's too early to say whether it will scupper plans for the 21st of June, and he will review the data along with the experts, and we'll know on the 14th of June.
So we shouldn't be distracted by the fact, because what they're saying, the cases are surging, but the hospital admissions are staying pretty flat. But actually, we're not really going to understand that for 2 weeks yet.
It's likely that will remain the case because of vaccinations, but only 44% of adults have had both doses of the vaccine, and it's both doses of the vaccine that protect you against the Indian variant. So it's all to play for over the next 2 weeks.
Goodness me. So I guess that just means a bit of caution.
Absolutely.
Really. Yeah,
absolutely.
Yeah, which we're all getting
Frustration, though, as you can imagine, the majority of our comments that we've had this morning, because I know that, Charlotte, you were talking about this earlier on, weren't you? It's just like, you know, this can't possibly end on the 21st. Freedom, you know, we've been building to all this. Everyone's been really responsible. Why should we have to stop now when we've been doing everything we possibly can? Because the government let these flights come in, if that's how it's all been transferred.
Well, that is the issue, because when other countries with lower infection rates were put on a red list, India wasn't. And we knew, flights were coming in, it got seeded in the country. It's now community transmission is the big way it's being spread, but it came in through those flights. And really, that's a question we need to ask the government.
Can we just get your thoughts as well on Dominic Cummings and Matt Hancock and the care home situation? We saw Matt Hancock trying to defend what he suggested with regards to sort of ring fencing and protecting the care homes, claiming that patients being tested before they went back in couldn't happen until he'd got the testing capacity up to 100,000. Although what Paul Brand pointed out brilliantly, ITN's Paul Brand, was that actually the capacity they only needed to test those care home residents who were going back was about 5%, and they certainly had the capacity for that. What was your experience at the time? Because you were there on the front line, Amir.
I was, and I can remember it very clearly. It was only a year ago. I was seeing patients in care homes, and they were being discharged from hospital without being tested. And that isn't necessarily the fault of the hospitals, because they didn't have the test to test them, and they were only being asked to test people who were being admitted to hospital rather than being discharged. And we saw it spread through the care homes, certainly the care homes I was looking after. And I get quite emotional when I think about it, actually, because we were going in, and these, you know, I've been working at the same practice for over 10 years. I know my care home patients really, really well. And they were dying. They were dying from this virus. Relatives weren't able to come in to see them. I was having conversations on the phone with family members when normally I would do that face to face. It was incredibly difficult. And treatment options were limited, and we weren't able to send them back to hospital either. So it was really, really tough. And to say that there was a ring fence around care homes certainly wasn't my experience at the time. And I think if we want to learn from this, you know, this isn't going to be the last pandemic we have. And we have to admit mistakes were made so we can learn from those mistakes and make sure they don't happen again. And I think the sticking point for me and a lot of people is that they're not admitting that mistakes were made. And that's a real problem. And I'm still having conversations with bereft families about what happened a year ago. And it's really hard.
But it's a dilemma, isn't it? And we're going to be talking to the Business Minister, Kwasi Kwarteng, a bit later on the programme, and, of course, to Jackie and Ian, as we always do, to get their insight on this. But, you know, we're talking about June the 21st. We're going to be hearing from businesses say that if it doesn't go ahead, if we have to keep those restrictions in place. And the argument from the Prime Minister has been, and actually from his various representatives throughout yesterday, is it's a big, tough decision to delay going into lockdown. And that decision was very hard. And he had to sort of think about whether to put the economy first or the other things first. So when you look at decisions, including care homes, is there an element of when something's gone the wrong way, you can look back and think, whereas at the time, you know, maybe it was the best they could do?
I'm not sure about that, because there isn't a separation between the economy and people's health. They're so interconnected. And we've seen what we've experienced, we've all experienced it, the fact that they delayed the lockdowns for the sake of the economy perhaps actually led to harder, longer lockdowns over the years, and it was worse for the economy.
Bigger problems for the economy.
So I don't really agree with that point, if I'm being honest.
OK, well, good.